So my name is Dr. Romina, and I've been in practice since 1995. You can follow me on my Instagram page. My whole purpose is to teach you everything that I've learned, summarize it, make it into an easier way to understand life, go through your health concerns, and become smart person and smart people instead of patients making an appointment or sitting in a waiting room. Because a lot of the things that I see my patients for could have easily been prevented had they had the right tools. So these webinars are specifically for that. So here we go, and let's have fun. All right. So your health condition is very much related to three factors in your body: your physical balance, your chemical balance, and your emotional well-being. And how slouching, which some of you might be sitting upright right now, is affecting your overall health and well-being. And what are we going to do about it? And how can we address this? So let's move on. But I do want you to realize that you cannot have a balanced body without addressing all these three factors. These three factors are the foundation and the pillars of your overall health and wellness. Obviously, they all have different branches and legs and subcategories, but let's keep to the basics and to the main foundation. You see, these are the typical symptoms of a hormonal imbalance. So go through this list and tell me which one of these you have experienced more than 3 times in the past 6 months. So just check them off. Anxiety, decreased libido, depression, lack of mood, hot flashes, depression again, reduced libido. Migraines is a big factor, huge factor in hormone. PMS to an extreme degrees, of course. If you feel like your muscle tone, pre or postmenopausal, and weight gain. Weight gain, thanks to COVID, has been a very common denominator between most of my patients during what we all went through over the past year. And I want to relate that back to the physiology of the body and how this whole year that we have been struggling with the uncertainties in our lives at every level, despite our socioeconomical status, how COVID has affected you not as a virus, but how it has affected you as an environmental factor in our life. You see, hormones, by definition with the Greek word, is setting in motion. Hormones are a class of signals, that molecules that are produced by a gland, and they go through your bloodstream and control and affect local or far away glands and organs, right? So let's say a secretion in your pituitary gland that's in your brain, a gland that's in your brain, affects immediately your hormonal balance, right? Affects growth. So that means affects the reproductive organ. In order for that message to go to your reproductive organ, it travels through the bloodstream. The interesting part that I want you to realize here is basically, if I was to give you a keychain of 100 items of keys inside, and you had to open 100 doors, I would be the organ, the keychain would be the hormones, and the keyholes where the doors open are basically receptor sites on the cells. So you need 3 items in order for the hormones to grow, to function. One is you have to have a secretory or depositing body. That could be the fatty cell membrane, or it could be the gland itself. Then you have the actual hormone, which is a molecule. Then you have receptors. And these receptors are specifically designed that are picked up by different parts of the body. The transportation of all these molecules is through your vascular system. There are 3 major parts or major categories of hormones. They're called eicosanoids, steroids, and amino acids, which I explained to you in the next slides. You see, how they work is these are the list of organs, or what we call endocrine. Endo means within, and crine means secretion. These are the endocrine systems, and for this particular presentation, we're only going to focus on the endocrine system. You have 3 major glands or endocrine organs inside your brain: your pineal, your hypothalamus, your pituitary gland, right? Then around the throat area, you have your thyroid, parathyroids, which are the four little beans behind your thyroid, and you have your thymus, right? As we go down around your abdominal area, around between your back and your intestine, mostly around your back, in front of your vertebrae, which is your spinal column, you have adrenals. Adrenals are like little Santa's hat on top of kidneys. They're a little triangular shape and a little slanted. And then you have your kidneys, and also you have your pancreas. Now, kidneys are not considered an endocrine organ, but they do have a huge effect. They're affected by your hormones immensely, especially for water and your sodium intake or water retention. Then as we move down around your belly button and your symphysis pubis, we're looking at your reproductive organs. The functions of the physiological, excuse me, the functions of your hormones are to balance your physiological regulation and your behavioral activities, which means that your body and your physiology is affecting your mood and your emotional responses. That's the importance of the hormones. So you remember we talked about the three types, the endocytes, the steroids, and the amines, the aminos. So the function of the eikonocytes is to affect prostaglandins. And I want to stay on this because eikonocytes are actually single molecule hormones, but the interesting part, they have a huge effect on your pain level. So pain that's caused by poor posture, pain that's caused by repetitive stress injury, and they also affect your hypothalamus, which regulates your fever or your body temperature. It is very typical in women with hot flashes, so, and also responding to an impact on your immune system. They also affect the mucous membrane of your digestive tract, as well as affecting the vasodilation or increased renal blood flow uptake, which means that how your renals function in order for them to be able to water retention and water secretion, which plays a huge role in your weight gain and weight loss, all right? And also your overall function of your kidneys and body detoxing. Then we move on into, of course, your reproductive organs, because these eikonocytes affect your uterine contraction, very important during menstrual cycle and pregnancy and lactation when you're breastfeeding. In fact, when you're breastfeeding, it contracts your uterine, which actually helps with kind of getting rid of that belly pouch after delivery. So I like throwing these little tidbits because it's kind of fun. It's kind of like trivial things that we know, and I love to share it with you. And we also, especially prostaglandins, are extremely important in the flow of spermicides or sperm cells. So if any gentleman is suffering from reduced infertility, checking their hormones are essential because prostaglandins would determine how fast the sperms are traveling. So it's basically the acceleration and the flow of the sperms. Then we also go into steroid hormones. So steroid hormones are typically your reproductive organs, are secreted by reproductive organs, your gonads and your ovaries, as well as your adrenals. Adrenals play a huge, huge role in how you feel and how your body, how you behave. It's specifically for flight and fright mechanism. And then we go into our amino acids, which is your pituitary, your pineal, your melatonin, your growth hormones, your thyroid stimulating hormones. A lot of medications are based on the amino acids, that they actually go in and affect the molecular structure of these amino acids. Progesterone, testosterone, estroidol, and epinephrine, norepinephrine plays a huge part on your cardiac contractions. So now that you have a basic idea of how important these different categories of hormones are, let's go into a different part of that. You see, they stimulate and they affect everything from your sleep habit versus your immune system function, which is very important at this particular time in our lifetime, in our life journey. Keeping your immune system strong is one of the #1 defense and shields you have against any viruses or invading bacteria and viruses to your body. So keeping your immune system healthy is not just by wearing gloves and masks. Those are external cover-ups. Keeping your immune system is much stronger when you build your immune system from within. And by not doing that, this is just a shield for you, but it's a very thin shield. And it's a very weak shield, whereas the strength and the ammunition of your immune system comes from your immune system. So keeping your immune system strong is the most important factor. And it doesn't matter if you're talking to a chiropractor, acupuncturist, a physical therapist, medical doctor, neurologist, immune specialist, or infectious disease specialist. We all say the same thing. Protect your immune system. And your immune system is not just what you eat, it's how you feel, it's how you behave and how you function. It's basically keeping your whole 3 physical, emotional, and chemical body balance intact, which I'll go into further detail. You see, different parts of the body function differently. Your hypothalamus and your pituitary and your pineal gland, and then as you move down this whole scale from top to bottom, it's almost like a command center. The organs on top control almost all the way down, and the organs in the middle control the local area, right? So the thyroid gland plays a huge effect on your metabolism. It's around your neck. If you are the type of person that has forward head carriage or has a tendency of having dropping your head forward, if you're too tall and you're kind of leaning over, you're really compressing your thyroid gland, okay? And especially for women who are suffering from, I just had a little brain infarct. Osteoporosis. For the women who are suffering from osteoporosis, it's very important that we keep their hormones at check. Why? Because parathyroids control the calcium, and your posture plays a role, especially your forward head carriage, on how it affects the actual function of the organ. Because you have these chemical molecules flowing, you have the nerves coming, but you actually have the organ itself, right? So it's kind of like you have your car, you have your engine, you have gas, and you have to put your foot on the gas in order for the car to move, or turn it on to go into drive mode. So there's multiple factors that allows you to function. So bring it back to your body. You have the hormones that are affecting the function and telling the organ what to do, or executing what the organ wants to do, the nervous system that tells it what to do, and how they all affect on your physiological and behavioral effect. But the actual organ has to function itself too. So keeping your body and your posture aligned is important in the overall health. So I'll go in detail more. Sorry, I get very passionate about when it comes to the body and sharing different aspects of not just putting the spotlight on one aspect. Your body is not just your hormonal balance or your endocrine system or your thyroid. It is affected by everything else from top to bottom, side to side, front and back. So you do have to look at your health and your wellness with the 3 pillars of chemical, physical, and emotional balance. Now, let's talk about, speaking of talking about nervous system, the difference between nerves and hormones is nerves have a very specific method of transforming information and relaying messages, right? And they have a path, whereas hormones are chemical messengers. So if nerve cells are physical messengers, hormones are chemical messengers, but they both have an impact on the function of the body. So the difference between a nerve cell is like a reflex hammer on your knee, that's a nerve cell, and a hormone difference, let's say a chemical imbalance is, a good example would be, have you ever been under stress, like have a little nervousness about it? That's when you start getting secretion in your acid in your stomach. That's the function of your endocrine glands affecting. In fact, every time I give a webinar, I do have that queasy feeling in my stomach because I know My hormones are like, oh my God. So where is the connection? I keep repeating about the three pillars, right? The physical, the chemical, and the emotional. And I do have some solutions for you as well. So it's not all bad news. So I want you to look one step further above the three pillars, which is the chemical, physical, and emotional balance. I want you to also look at the spiritual factor, what is surrounds us. So those of you who are practicing yoga very much relate the components of your organs and your behaviors to the yoga poses. And I want to bring this whole thing together for you. Remember, we talked about the endocrine glands. Let's location-wise and anatomically look at the correlation between different body parts and the location of those. So if we look at the crown or the chakra right behind your third eye is exactly where the pineal gland are sitting, which is a major component of your upper endocrine organs. They also control the hormonal, the physiological regulation, and your sleep pattern, which is very important. Your sleep pattern plays a huge role in your overall body physiology function. It helps your parasympathetic, sympathetic nervous system to be in balance. If you're talking about the autonomic nervous system, it also controls the endocrine system, which is very important, and also affects your spiritual balance. So your sleep pattern are very important. Then we look at the thyroid gland, which is around your throat. They believe it is in yoga, in the chakras, they believe that a woman that has her head down, your throat chakra is responsible for you to speak the truth and be able to have a voice. With your head down, it's very, they relate that with lack of self-confidence. They also relate that with being timid. And also, it's the same area that feeds off this cervical spine, feeds off to your arms and shoulder and your fingers, right? So if you're getting any numbness and tingling. The position of your head and your shoulders and your head and neck on your shoulders is extremely important in the overall balance of the body. It does affect different plexuses and different organs, which is, again, remember we talked about the metabolism of calcium regulation? That's exactly in the throat area. Again, your body is all connected. It's not just one item, all right? And then we go into the heart chakra. And I stay on this particular area a lot because slouching is compression of your rib cage. And that compression of your rib cage compresses the organs that are encapsulated in your rib cage, such as your heart and your lungs, the two major organs, which are very much affected, that we talked about earlier, by endocytes, which is the leukotriene hormones, right? But moving on, it affects your whole electromagnetic field generator. It affects your blood pressure. It affects your immune system. It does affect any kind of breathing. Lack of oxygenation due to slouching also causes fibromyalgia. Fibromyalgia is also one of the symptoms of hormone imbalances. Keeping your posture into an upright position is not just a physiological effect, but it's an effect on your overall physiology that affects your hormone function, that affects your emotional balance. And if you want to stay in a spiritual path, your heart is the ability to accept and relay love and connection and trust, which are the three basic hormones related to love and trust are serotonin, oxytocin, and dopamine. Now, moving on, I know I'm kind of like connecting these together, but I want you to start thinking about it and start looking into it and see the correlation between all of them. It simplifies back to having a balance within your body, no matter what your body size and shape is, but listening to your body as if your body was talking to you, as if it was your child. So listen to your body and react to it by what it needs, and provide it and maintain a healthy environment for your body. My job is to offer you and guide you into what are those things that your body needs. So if you go back, how many of you have digestive issues who sit a lot? I'll let you tell me. Or you know of someone who has a lot of digestive issues and has a poor posture or sits a lot. Well, that person is affecting their solar plexus. The solar plexus right here is responsible for digestion and assimilation. Sitting for a prolonged period of time affects your thoracolumbar, which is right around below your bra line for you ladies, and for gentlemen is just like if you put your hand in the small of your back, it's where your thumb sits. If you put your hand up there, right? That would be your thoracolumbar junction. It's very important, and it's the actual insertion of your iliopsoas muscle that attaches to your hips. So if you've been reading things that are iliopsoas causing low back problem and hip problem and pelvis issues, it is not just that. It's a lot more than that area. And also, just so you know, your strength and your power comes from your solar plexus. It's your power source as far as spirituality and chakras are concerned. And then we go into your sacral plexus, which is your lumbar, your reproductive organs. And that is all your how you react, your emotions, and how you react to situations. You get too angry, you get too upset, you're passive, aggressive, all that information. Sexual drive is definitely a gonadal problems in affecting your hormones of testosterone, estrogen imbalances. So looking at your connection, I want to take it one step further and ask you, how many of you can relate to this image? And let me talk a little bit about biomechanics and come off the subject of hormones, and I'll get back to it as well. Your head weighs about 8 to 15 pounds. For every 1 inch that your head is more forward compared to your shoulder, there's an extra 10 to 15 pounds of pressure on your upper back, 3 times more on your lower back. So if you're an attorney, an accountant, and a dentist, a dental hygienist, or a tattoo artist, and you're sitting and you're leaning forward, for every position that you move, you're actually overloading your lower back. And that's why you wake up and all of a sudden you have a disc problem, right? Besides the fact that you also start having symptoms of lack of energy, little like overreaction, mood swings, digestive issues, they're all related. So going back to that, it's very important. Also, if you're looking at kids these days, they're affecting their thyroid. So we're not talking about now physically, we're looking at physiological and chemical imbalances in 5-10 years from now. So if you have any children that have posture issues, please reach out to me. I have a test, I could give it to you. You just basically take it at home and we'll find out what stage of mild, moderate, or severe posture problem they have. Your nervous system controls the healthy function of every cell, organ, and tissue of your body. That nervous system could be either your autonomic nervous system, could be your central nervous system, could be your endocrine neuroepinephrine or neurological system through the glands and hormones, and also the whole resetting of the body, how it affects your entire organs. Sitting or standing, doesn't matter, in poor posture affects your overall health as far as physiologically and behavioral is concerned. So there's one thing you can control on an immediate basis, and that is your posture. So for that reason, I used to recommend a lot of products to my patients, and these products were people would get lost in the sea of Amazon or Google of what to buy. So I put together a specific group of things that you would need to address posture. And I also put together a specific group of things that you would need at home to relieve the head or numbness and tingling down your shoulders, or if you just want to have a basic ergonomic station at home. With the at-home problems right now, we're seeing a lot of kids that are sitting at home and doing their homework or doing homeschooling. It's very important that you provide them the basic ergonomics at this age. Their body is growing. Do not neglect them because they will become my patients or somebody's patients. So I'd rather you spend scheduling your time for vacation and doing adventures and activities instead of scheduling office visits. So to avoid that, take the preventive measures that you can do at home for what has been put together specifically for the conditions of such, to alleviate, relieve, and help support. So let's talk about nutrition and hormone. So bringing it back to hormone, there is a program called the Hormone Diet that actually has proven to help people lose up to 12 pounds. I know, it's fantastic, right? So this hormone was designed by a medical doctor and naturopath. Dr. Natalie Butler is one of them. So the hormone diet is basically, it's 6 weeks and 3 steps. In these 3 steps, I'm going to break it down for you, how it's going to reset the balance of your hormones. So step 1 is detoxification. Detoxification is basically during these 2 weeks, you're going to avoid a certain group of foods that are aggravation to a hormone balance in the body. So definitely gluten-containing grains, many oils, alcohol, caffeine are extreme chemical irregularity, cause a lot of chemical irregularities in the body. Therefore, it's highly recommended to avoid those throughout the whole entire 6 weeks, but definitely in the first 2 weeks because you want to detox and clean your body. Red meat is one of them. Citrus foods. Citrus fruits, you definitely want to avoid those, and then replace them with naturally gluten-free grains, fruits and vegetables, definitely not citrus fruits, right? Fish, make sure that they don't have any mercury in them, and dairy from sheep or goat or plant milks like almond oil, cashew milk, almond milk, and then start putting probiotics into your body. Probiotics helps retrain your digestive or your gut health. Reason being is basically your gut is almost your second brain because a lot of enzymes are produced during this part, and it's actually the part that cleanses your body and absorbs and extracts nutrients, vitamins, minerals from your food. So keeping your gut healthy is very important. It's that machine that needs to work to function properly. So probiotics, adding turmeric to your tea, to your juices, to your drinks is very effective. Doesn't have to be much. And also fish oil, which is very important in growth hormone. Phase 2, you avoid foods that have hormone in it. Definitely man-made food. If it's packaged in my household, if it comes in a box, you do not buy, other than almond milk and plant-based milks. But if it's processed, if it comes in a package, you do not buy it. That's just that. We get it fresh. So corn syrup you need to avoid. Fish with high mercury levels, so make sure where you're having your sushi, or contact local seafood farmers that could actually bring you healthy products. Non-organic meats and non-organic coffees are the ones that are actually aggravating. Those are things you really want to avoid. Dried fruits, raisin, dates, and peanuts. You definitely want to avoid those. I know. We thought that they're healthy. I guess in this particular hormone balanced diet, you definitely need to take them out. And by the way, this presentation is available, so please make sure you share it with anybody that could benefit from it. And the last phase, which is your cardiovascular and strength training. It goes back to motion, physical well-being, and physical health. Even if you don't take anything out of this program, this webinar that I provided, please make sure that you exercise. Exercise is the most mood elevating, increases your serotonin level, increases your dopamine level, increases your oxytocin that are naturally in your body. So I highly recommend you do exercise, even if it's just walking around. Now, if you want to have a double effect, because I like to multitask if it's possible for time efficiency, wear your posture supports from your home kit and go for a walk. This not only hacks your nervous system in retraining your muscle behavior, it actually increases your oxygenation, increases your energy, and also you're exercising at the same time. If you want to exercise with maybe some weights in your hand, you're already doing strength training just by walking with weights in your hand. Keeping your chin up when you're walking so it's parallel to the ground also helps with your posture, so you actually strengthen your extensor neck muscles. To avoid anxiety and to avoid depression, keep your hormones balanced by cardiovascular exercise and strength training and change your posture, please. Sleeping is very important. If you put yourself through, if you have difficulty sleeping, just a little health tip. If you wake up between the hours of 2 to 4 in the morning, you either have a pancreas or adrenal insufficiency, or you have a hormonal thyroid inefficiency imbalance. So make sure that you find a way in order to regulate your sleep. So the first thing we want to do, we want to make sure that your environment is correct, right? So again, get your home kits. This is very important. I can't emphasize enough, because everything is summarized into one kit for you. You don't have to go find one or two things, which is not going to be as effective. If you're going to do something, do it 100%, do it once, do it right, and get it over with. Then it's afterwards, it's maintenance, which is so easy. I want to go to this part, sleeping. Sleep plays a huge role in your physiological well balance. So your sleep posture is very important. There are a couple of things you need to address. One is your pillow. So there's two types of pillows. There is pillows that help you, that feel good. You just like their consistency. It's very personalized. And there are pillows that have a functional effect on your overall body. The pillows that feel good, I'll let you choose your style, your type, but let me talk about the style. If you have forward head carriage, and if you have upper back and shoulder problem, and you know you're stooping, please get pillows that look like number 2, 4, 3, or 6. If you have, if you're a back sleeper, I highly recommend number 2 because it promotes proper curve in your neck, so it works for you, or number 6. If you're a side sleeper, I like 4 and 6 because it cradles your cheek, so you're not looking up or you're not looking down when you're sleeping, if you're in the fetal position. If you're a stomach sleeper, a body pillow like number 7 is going to be very effective for you. If you are working at a desk that has a sit stand, make sure you stand during the day when you start your day, and you sit in the afternoon. This reduces factors such as restless leg syndrome, varicose veins, fatigue in your lower back, or leg pain or ankle problems, right? And keeping your posture at a 90-degree angle when you're sitting is very important. Always sit either at the end of a chair or at the edge of a chair. When you sit in the middle of the chair, it's the worst place to sit because it has a lot of slouching. It increases your margin of error of slouching, right? To minimize the margin of error, sit all the way with your back supported by the back, or sit at the edge of the chair, so that way any movement can make you slip, so your innate intelligence and innate protective system keeps you upright. Most ergonomists suggest that you keep your top of your monitor at your eye level. That promotes straight neck. Straight neck is a precursor to degenerative arthritis. Move your monitor about 15 degrees so your eye level, actually the top of your forehead, is on top of your screen. That's going to be effective. One more thing I wanted to share with you is, please make sure, I want to share this with you, which is very important. Make sure that your screen of your phone is aligned with your eye level, and hopefully either use your hand underneath your elbow to keep the phone in front of your face, or when you're sitting, make sure that you're leaning against the counter, that your screen is in front of your face. This would avoid any kind of problems with forward head carriage. And again, if you need any help, reach me. My website is Think Healthy. And I'm locally in downtown Los Angeles. My office is there. You can always find me on Instagram for health tips. And every Wednesday, I come to you with health and wellness tips that could hopefully change your life for better. Whether we see each other in person, I would be happy. But if I don't, I hope that this presentation has been effective and helpful for you. So I wish you a wonderful Wednesday, and keep your questions coming as we formulate our next webinar. Thank you, and thank you for attending.